Hello, welcome back, everybody. Welcome back. Thanks for joining me this morning. I'm sorry, I'm starting a little bit late, but I'm glad that I'm back on. We couldn't have a session last week because I was a bit under the weather, but it's great to be back talking about questions from the channel. My name is Dr. Sylvia. I'm a general practitioner. I'm also the founder of AskAwayHealth. So if you're joining me on the live, great to have you here. And if you're watching on replay, thank you so much for clicking. We're going to go straight into today's topic, which, of course, as usual, is a question that someone has sent in. And I love discussing these questions here because you know that on YouTube comments, there's such a limited amount of provision, or you just can't discuss things. It's one thing to send a question, but I need to ask so many other questions to understand better, to clarify background medical details before trying to provide any information to guide you. So I love bringing it to the live stream so we can discuss the range of possibilities. But you know that if you want to reach directly out to me, you can. We have the email health information service, so please use that. I'll place the link in the description box below. And if you're popping in, please say hi. I think there are a couple of people joining the stream. Thank you so much for joining. Please say hi and don't forget to subscribe. I would just love to use this opportunity to say thanks to new subscribers and returning subscribers over the last month. Really, we've seen such a big growth in the channel. Thank you so much. You're the ones who make this worthwhile. You make it happen. The engagement is fantastic. So thank you so much. Don't forget to leave a like and subscribe to the channel. I'm going to be flicking from one screen to the other, so bear with me in case I'm not looking directly into the camera from time to time, but I just want to check my notes. Today's topic is, so let's just put that on. Yeah, so this is today's topic, and it's about the Depo shot. I thought it was a really lovely comment. This is just the way it was presented to me. Just after 10 years of being on the Depo, I'm literally scared to come off it. That was exactly as it was sent in. And I didn't really get the chance to be able to clarify what's making you scared, why you worried about coming off the Depo, and questions around, you've been on the Depo for 10 years, what's been your experience? So many things to look into with that little statement, but this is the opportunity. This is the opportunity for us to now go into detail. And if you're there, or if you're here and you've been using the Depo for this long or longer, or are thinking of using the Depo as long as you'd like, but you've got questions, or you've not even started using the Depo and you just want to understand how it works, please let me know in the comments. Please share this with anyone who you think is having issues with the Depo, wants to ask questions. Let us go through this and try and work out, get an answer to this question. So today's live stream is all about the Depo shot. Okay, before we get started, how are you doing? How has your week been? How have you found the first few days in July? Like a joke, we're near the end, we're sort of midway across the year. So once July is over, then we're thinking about the end of the year. Can you imagine? Just like that, 2022. Oh boy, oh boy. Okay, well, so let's get started. So a little bit of background. I would usually like to give you a bit of background, but please remember that I do have a couple of videos on the Depo shot, looking at how it works, looking at long-term side effects, really distressing side effects, and so on. So please check those out. Again, I will place the link in the description. But just by way of background, when we say the Depo shot, we're talking about the birth control method, which is known as which contains progesterone, the hormone progesterone, and is usually given as an injection. That can be an intramuscular injection, so your nurse or caregiver or doctor might talk about IM injection, or it might be which is given directly into the muscle, okay? Or it might be a subcutaneous, so they might say subcut or SC injection. And those are usually the preparations that are marketed or sold as being self-administered, so you can give those yourself and they go into the skin rather than into the muscle. So you've got different types of Depo progesterone injection. So I'm just going to call it Depo shot so we don't get mixed up. But there are different types, different doses, given in different ways. So to be sure the type that you have, there may be small differences here and there, but generally what they have in common is they contain the hormone progesterone. So this birth control method suppresses ovulation or inhibits ovulation. Ovulation, of course, is the release of a mature egg from the ovary. And generally what this means is that the available amount of estrogen while you're on the Depo is reduced, but then this is the way it provides contraception by inhibiting ovulation. So that's what it is. Let's look now at possible reasons why somebody might say she is scared she's scared to stop using this method. So let's think about it. She's been on Depo for 10 years. Now, if you're taking the Depo shot injection usually the intramuscular injection that's given to you by a nurse or by your doctor usually is given every 12 to 13 weeks. So just picture this, that somebody has been getting this injection every 12 to 13 weeks for 10 years. And they've gotten to the point now and they're thinking about or considering, or the idea has come up, but they're scared to come off it. Why? What are the reasons? So I thought it was interesting to look at the possible things that could be going through their minds. And the first one I thought about was the fear of stopping the injection and the delay in return of fertility, delay in the ability to get pregnant, the delay in the return of the periods. This is a common concern, and whether you take the Depo for 1 year or 18 months, or whether you take it for 5 years or 10 years, and you're still interested in having a family, you could still get caught within that characteristic of the Depo, that it can take up to 12 months for a return of normal periods and therefore return of fertility. So I've said to us on videos before, and I say to my patients as well, that if you're on the Depo shot, what you need to be thinking about is medium term, long term, what exactly is the plan? Because if you're thinking you want to be on it for 6 months, half a year, or for a year, and then you're thinking of starting a family, then you need to be saying to yourself, how soon do I need to come off this method? Because I want to start having a child. It's different from taking the pill, the mini pill, which also contains progesterone, but the amount of progesterone in both drugs is widely different. The difference is that with the mini pill, you stop taking it within the next month or couple of months, your fertility has returned, your periods are back on, and then you're looking at getting pregnant. With the Depo shot, you might have that delay. So this is one thing that could make a woman feel really uncomfortable about coming off it. She wants to do it, she needs to do it, but she's worried. And how can you improve your fertility? What can you do? Like I said, the first thing is to have a plan. Be aware that when you come off the Depo, it could take some time for fertility to return. So you can't stop it today and expect, right, I'm going to get pregnant in 2 or 3 months. If that happens, fine. If it doesn't happen, we're not going to panic. It could be because as a result of the Depo, and some women could experience that up to 6 months or longer. They say up to 12 months. So factor that into your planning. I would say if you're thinking about how to improve your fertility, get the plan right, get your timing right. But outside of timing, what else can you do? Please don't stress about it, because the worry, the concern, that mindset, what's happening to my periods, going from one place to another, trying to get one test or the other because you're thinking there's something wrong, can also affect the return of your periods, just that state of being stressed about the whole thing. So it's also important to be aware of what's going on in your body. Consider that this is potentially a side effect of the drug, and stay calm, avoid anxiety and panic about why am I not getting pregnant, especially if you've recently come off the Depo. The next thing I'll say, number 3, exercise. So a healthy mindset, healthy mind and body. We've just talked about avoiding stress, but also your body. So some form of exercise, swimming, yoga, aerobics, whatever it is, going to the gym, lifting weights, whatever it is that you're into, taking walks, whichever it is that you're into, that you can commit to over a period of time. The benefits countless. I'm not going up. Today's video is not about the health benefits of exercise, but of course we know that that would help to keep your weight down. That will improve your heart activity, which you definitely need as you get into pregnancy, and of course keep your muscles supple. So many things involved in terms of getting your fertility, helping to get your fertility back after stopping the Depo. That, of course, is related to eating in moderation. So watching what you eat. I'm not a huge fan of a particular diet type or the other. I believe in moderation in whatever you're eating. But just being very conscious that what you want to do is cut down on high saturated fatty foods, takeouts and processed foods, high salt diets, very, very minimal amounts of alcohol, sugary drinks and so on. Being fully conscious that these things could make your blood cells, make your muscles less healthy. And what you want to do is put your body at an optimum state for getting pregnant. So it's really important to be thinking about those key things: your exercise, your diet, avoiding stress, and planning. These are some of the things. Supplements, fine. If you're already you guys are you and your partner are being sexually active, you're having sexual intercourse, you should be on folic acid supplements, because you don't know when it's going to happen. And what you want to do is provide all the nourishment and all the protection that your baby needs if you get pregnant. So already having that mindset of behaving like somebody who is about to fall pregnant, especially when you've been off the Depo shot for a number of months. So that was one point that I thought, could somebody be worried about coming off the Depo for this reason? So if you're just joining the stream, welcome. Thank you for popping in. Please stay around. We are discussing today concerns about coming off the Depo after you've been on it for a long time, for, in this case, 10 years, as somebody commented. I'd like to say hi. I've got a couple of people hopping in on the stream. Please say hi. Don't forget to like the video. And we're talking about the Depo shot. We're talking about its long-term benefits and complications. So please send in a question at the comment if you want to. That would be fantastic. So going on to the second point, and don't forget, we're looking at possible concerns that somebody might have about coming off the Depo after they've been on it for such a long time. And it's this. You know that if you've been using the Depo, one of the things that you would experience is you stop having regular periods. So some women actually have very little blood loss with a scanty blood flow while on their Depo, but a good number of ladies will actually have no periods while on the Depo. Now, some people are worried about that, not really happy about, but for some people it is the bomb. Some people are happy with that kind of situation. So a concern might be that she's going to lose that freedom from having to wear sanitary towels, from having to use panty liners, from having to use tampons, wear menstrual cups, and even buy them. The money going to be spent on buying them, she might be thinking, oh no, my periods might come back and then I'm going to have to get into all that. Because 10 years, goodness, imagine 10 years without periods. So that might be another thing, that she's scared of losing that freedom of no periods that she's had. And don't forget, many ladies usually get on the Depo shot for birth control, but don't forget that it can also be used to treat bleeding problems, heavy menstrual bleeding, particularly in the UK it's licensed particularly to treat endometriosis, which if you're familiar with my videos, can cause heavy painful periods. Please go and have a look at my endometriosis playlist to learn about this condition. But the Depo shot is one of those treatment options that women can use, and because it nullifies, if you like, the periods, women can be absolutely free of that pain and that heavy blood flow, and they might actually experience no period. So imagine somebody who's been on the Depo shot for that purpose and then is about to come off it and potentially facing a return to that troublesome type of bleeding. That's one possibility. That's one reason why she may be concerned, okay? Because of the loss of the amenorrhea or the lack of bleeding that happens when you use the Depo. Now, the third point I came up with is weight change, weight gain in particular. Let's call it what it is, weight gain. That's what many women have heard about and that women are worried about when it comes to the Depo, that taking the injection can make you gain weight. And I think this also, it depends on your experience, to be honest with you. Some women might be concerned that when they come off the Depo, they might actually gain weight because there's some after effects, and I have done a video on this. What are the effects that you might experience after stopping the Depo? Some women might be concerned about actually gaining weight. Again, all this has to do with the regulation of hormones. Don't forget that the Depo, you're getting every 12 or 13 weeks or 8 or 10 weeks, depending on the particular brand you're taking. You're getting these shots of hormone into your system, which are shutting off your natural hormones. So when you stop taking them, there's gonna be a return of your natural hormones. But initially, they're just sort of firing from all engines. It's a bit chaotic when things are trying to get back to normal. So it may take a while, and that's why the issues with weight gain, the issues with delayed return of the periods, all that is because of the natural hormones haven't yet started flowing. They're not coming out, or they're not being produced at a what's the word I'm looking for now? They should be coming. The hormones should be produced at a level or at a pace that is consistent or that goes with the way your body functions. So it's not chaotic, but it's either it's up in the morning and then it goes down over the evening, up in the morning and then goes down in the evening. There's a pattern. But initially, when you first stop the Depo, the pattern is absolutely non-existent. So that's what I'm trying to explain, that the pattern takes a while to return. And that pattern, when it comes back in, then these problems with all these after effects from using the Depo, acne, headaches, other skin problems, weight problems, bleeding problems, fertility, all that will calm down. So my thinking is has she had an issue with weight while on this method? And conversely, I know it's really hard to believe, but some women have also talked about weight loss, not as often as weight gain. But so what I'm trying to look at is concern about changes. Just like somebody was on the Depo, she didn't have periods, fantastic. And now she's thinking, if I stop the Depo, are they going to come back and they're going to be really bad when they come back? Somebody may have had issues with weight and then got on the Depo, things seem to stabilize, and then she's worried about coming off it. It's not very common, but again, we're discussing this possibility, what was going on. Hi to anyone coming in on the stream, thank you for joining. We're talking about the Depo, particularly when somebody's been on the Depo for a long period of time, like 10 years, and they're talking about being really scared to come off it. What do they mean? What are the issues that they may be thinking about? So if this topic is of interest, please send me a comment or ask a question around it, or but don't forget to like the video and subscribe to the channel. So that's weight changes. I've talked about the Depo side effects. Again, I've got a video on the channel around that topic, but they may be unexpected. So these are symptoms that you don't expect. Poor sleep, bloating, there are quite a few of them. And I really think if you're on the Depo, honestly, if you're on the Depo, regardless of how great it is for you as a method, have a look at that video. Have a look and just be familiar with some of the issues. They're not horrendous. They're certainly not life-threatening, but they're sort of maybe some distressing, a bit of a nuisance kind of thing that might happen for a couple of weeks, a couple of months after you stop taking it, because your body's natural hormones, like I've just tried to explain, take some time to get back to their regular pattern. Okay, next, the loss of benefits. Did you know that when you're on the Depo shot, there are a few benefits that you might actually get? Most of the time the press is all about the negative effect. Oh, it takes a long time for your fertility to come back. Oh, this happens. And don't get me wrong, please. I'm an advocate of, if as a woman you're having trouble with your contraceptive method, please don't sit and cry about it. Come and talk to us, okay? Some women can have really horrid experiences on some of these methods, while some women, they're having a ball. But I would really say, we tend to talk a lot more about the, the sort of complications and the risks, and sometimes don't give too much attention to the benefits. Taking the Depo can have some benefits. We've talked about women who love the fact that they're not having periods, they're not having to buy towels and tampons and so on. One of the benefits of the Depo is that it's not associated with an increased risk of ovarian or womb cancer. And in fact, some studies suggest it may protect. So just being conscious of that, just being aware. And somebody who's on this method may think, wow, what if I lose this protection? So that's a valid reason to be scared to come off it. And I'd understand that, and we'd be looking at what alternatives can you use, what else can you do to protect yourself and reduce the risk of that happening. Okay, so I think that's about 5 benefits I've come up with, and I've got an extra one and that looks at its benefits in a group of ladies that we don't often talk about, but this is ladies with sickle cell disease for whom some of the other methods can be an issue, particularly things like combined hormonal birth control methods containing estrogen and progesterone, where there may be an increased risk of developing blood clots. Because in sickle cell anemia, especially if somebody is particularly prone to experiencing lots of sickling and lots of crises, they may already be at that risk of developing clots within their blood vessels, and then you then add on a method that can increase the risk of that happening. That's not good. So the Depo is a solution for this group of ladies, because that risk of blood clots forming in the blood vessels is less, not actually associated with the Depo injection. So could this person be in that category? Could she be that one person or lady who has been using the Depo for 10 years because she has sickle cell anemia and it's been fantastic, but for some reason she wants to come off it? Maybe she wants to have a baby or whatever, and she's literally scared as a result of that. Now, obviously, if she's doing that because she wants to start her family, then what we're looking at is other measures to protect her in terms of preventing sickling crises, preventing bone pain, preventing all the other issues that could happen, avoiding things like dehydration, avoiding things like infection. Again, on the channel, we have a great sickle cell disease playlist, where it's good to have a look at the treatments and the cures I talk about for people who have sickle cell anemia, whether they are SS or AS, SC. I do talk about that, the things that you can do to improve health generally. So guys, these are my thoughts in terms of this particular question. If I had this lady in front of me, I would go through these sort of 5 or 6 points. And then, of course, find out from her what exactly is she concerned about. But I really thought it was interesting to just tease that question. And if you have any thoughts, or if it was you who sent in this question and you come across this video, please drop a line in the comments. Let me know what else you could be scared about. But we've covered that, I think, to quite a reasonable degree. And the other part I wanted to address with regards to long-term use of the Depo was, what are the risks? Because we've sort of been looking at this from the side or the point of view of somebody who's been on it for 10 years and she's had a good time and she's scared of coming off it. That implies she's had a good time with it. But now I want to talk to somebody who's thinking, can I stay on this method for long term? Are there problems? And another question that's related to this, how long can I actually stay on this method? Is it safe? Let's look into that subject. Let me just quickly pop back into the stream, see if there's anybody sending a message through. Don't be shy. I haven't got any comments, but a couple of people have popped in, like ghost viewers, I call them, because they pop in and they don't drop in. But that's all right. So what I'm going to do is get into this next segment of the discussion where we're talking about what are the risks that are associated with long-term use of the Depo. But first, how long can you use the Depo for? What do you think? What, 6 months, 2 years, 5 years? What have you heard? So, according to our literature and our studies and what we use to guide treatment or people taking this method, we will say there is no fixed age or there's no fixed number that anybody will say to you, okay, you get to age X and you can stop. So it's flexible. It's flexible and it's subject to 2 main things, I would say. One, your desire. Would you like to continue this method? Are you happy with it? Does it suit you? That's one. But the second one that they must be considered together is, what are the possible risks for you continue that method? So it's not just that, oh, I love this method. It's also about, but is it good for me? Okay. So generally, I would say, if it suits a woman, she has no medical problems preventing her use of the Depo, and we consider the risks and the benefits, she can continue using it until she doesn't need it anymore. Now, of course, we're getting into the perimenopause. We're talking about getting into perimenopause, getting into the menopause, when, of course, if it's being used for the purpose of birth control, then it's no longer needed after a woman has reached menopause. So if you say that many women hit menopause by about 50, most specialists, most of your healthcare providers would say by the age of 50, you can come off it. And you'd even be more confident to do so if you've not seen your period for at least 12 months. Remember that our definition of menopause is a woman who has not had a period consistently for the last 12 months. So no bleed for the last 12 months. If she had a bleed, if she was getting to 11 months and then bled, we start counting from that point, because she is still perimenopausal until she has been free of any vaginal bleeding from 12 months before we say, okay, she's at menopause. Okay, so generally they use that age of 50, just roughly, because some women do not reach menopause at 50. They may take a couple more years before they get to menopause. But on average, at the age of 50, we will be saying, okay, do you want to consider another method? And the only reason we say that is because, of course, as you grow older, the risk of certain conditions which don't play well with the Depo are higher. I'm talking about things like heart problems, heart attacks, cancer, liver disease could be more likely at that age. So that's one of the reasons why they sort of peg it at that age. You might be asked to consider an alternative. But the most important thing is, if you're on the Depo now and you're finished having your kids, let's say you're 35 or 36 and you've been on the Depo and you think, I like this method, it works for me, I'm happy with the injections, happy I ain't got no bleeding, I'm happy it's not giving you any weight problems, I want to stay with this method. It's fine. All we want is every 2 years, okay, if you don't have any medical issues, every 2 years come and sit down with your doctor, have a chat, get your blood pressure checked, have a chat about your risks. We want to know if there are any changes, any conditions. So we'll check your blood pressure, we'll have a chat about cancer risks. Are you doing your breast examinations? Are you having your cervical smears? Because what you're trying to look out for is any condition that doesn't play well with the Depo. And if at that chat everything seems okay, then your doctor says, okay, all good to continue for another couple of years, come back and let's talk about it. So you can continue this method, but it's essential that you keep coming back in to have that chat, unless something happens, you fall ill. So, and the other thing as well that your doctor will be looking at is other risk factors for heart disease. So for example, if you smoke, okay, if you smoke, if you're diabetic, if you have high blood pressure, if you're overweight, if you have high cholesterol levels, these things collectively and individually can increase the risk of heart problems. They don't play well with the Depo shot. So remember we talked about, as we're growing older, the risk of these heart problems developing. So as you're growing older, your doctor is sort of adding these things up. So if you come in and say, you're smoking, you're diabetic, it's not that being diabetic itself is a risk factor. It prevents you from having the Depo. But if you add that in with smoking and having high blood pressure, you might be saying, should we look for a safer method? Because you're taking this Depo shot, it's a big amount of progesterone. It may contribute to certain problems, blood clots, things like strokes or mini strokes and things like that, because of those additional risk factors. That's why it's important to have those regular checkups. And if there's any change along the path, then we will say we think this method should change. But if there isn't, if you're not a smoker, if you're not diabetic, if you're not hypertensive, you're healthy, you're fit, you're happy with the method, all the T's are crossed, all the I's are dotted, it's fine to continue. Let me just quickly mention conditions that your doctor might also want to be careful with. If there's angina, if there's any type of peripheral vascular disease, so there poor circulation, people with poor circulation, trouble with their blood vessels, and if somebody has complicated blood pressure, high blood pressure, so they've already got high blood pressure that's difficult to control or has already caused damage to organs like their eyes or the kidneys and things like that, people who've had mini strokes or who've had a stroke, or somebody who's had unexplained vaginal bleeding. Those are the kind of scenarios where your doctor will want to sort of pull back and say, we need to be looking at another method. The Depo would not be suitable for you. Okay, so we're talking about, hi to anybody who's popping in on the stream. I'm just going to quickly check back in for comments. Please don't forget to like this video if you come across it. Again, we're talking about long-term use of the Depo. It started because one of my viewers brought in this comment and said she was scared about using the Depo, and I thought that was interesting. Why is she scared to come off the Depo? And we've looked at that. We've taken a look at that. So if you watch the initial part of this video, and now we're looking at the complications of being on it for a long time. And when I say long time, we're looking at sort of 10, 15 years. And how long can you actually have it safely? So we've looked at some of those risk factors. We've established that you can potentially have it as long as there's no upper age limit. You can potentially have it as long as you wish. However, there are conditions attached to that, and those conditions include your health. We have to weigh the benefits and we have to look at the risks. And always we want to, if the benefits are higher and the risks are low, then it's safe. But if the risks are piling up and you're thinking this is not worth it, that's really important. Okay, let's look at a few more complications of long-term use of the Depo shot. There is a weak association between cervical cancer and the Depo if it's been used for 5 years or longer. And according to evidence compiled by the Faculty of Sexual and Reproductive Health in the UK. So there is a slight association between cervical cancer and the Depo shot, okay? Now, with cervical cancer, the key things that we should always be familiar about are having your cervical smears regularly, paying attention to any changes in vaginal bleeding. You don't ignore. I've got lots of videos on causes of vaginal bleeding after sex. I've got a video not too long ago on cervical smear and errors around smear, which also gives some information about cervical cancer. So please have a look at these on the channel. But these are the things that are important. It's important to add as well that risk, that slightly higher risk that I've mentioned, does reduce with time after stopping the Depo. So let's say somebody has been on the Depo for 6 years. So what we're saying is that risk of cervical cancer is slightly higher compared to somebody who's not on the Depo. But if she stops the Depo at the 6th year, within a couple of years, her risk of cervical cancer drops down. It's as if she didn't have the Depo in terms of causing or contributing towards cervical or increasing her risk of cervical cancer, okay? Now, similarly, there is a possibly weak link between currently using the Depo and breast cancer, okay? So breast and cervical cancer, let's pay attention to those. There's a slight risk while you're using the injection, if you've been using the injection for 5 years or more. So I've put them in there just so that we're aware. But these risks go down to the same as the general public after you've stopped taking the injection. So this is something for us to be aware of. How do we mitigate these risks? I've already talked about your cervical smear. Don't miss it. Make sure you're up to date with your smears. Keep an eye out for unexplained, unusual vaginal bleeding. Let's be clear what's causing it, okay? Breast self-examination, keeping an eye and hands on your boobs to be clear. Any change, anything that feels different, looks different, go and have it checked out. These are the ways that we mitigate these risks, being familiar with what your breasts feel like. So if you spot any change or anything different, you can go and speak up to your healthcare provider. And then, of course, I should mention the effect or the concern about bone mass, the bones, and the concern about fractures. So when it comes to the Depo shot, Depo injection, the studies have shown us that in women taking the Depo shot, there is a slight, it does affect your bone mass. It reduces your bone mass. Why is this important? It's important to us because by taking the Depo shot, it suppresses ovulation. Remember I said at the beginning, and one of the things that does is reduces the amount of estrogen circulating. And one of the effects of that is the bone health, because estrogen contributes to supporting our bone health. So what they've noticed, or what's the situation on the ground, is that when you first, the amount of bone loss, and it's not a huge amount, but it's just enough that if it's carried on over time, it may become significant. And it's one of the things that your doctor will check with you every couple of years. So this effect on your bone health, there's a greater loss within the first initial year or first few months of starting. That's when the loss appears to be greatest. It tails down as you continue, but it does still continue, okay? And they notice that it's actually in women under 18, particularly women under 18, they've not reached their peak bone mass as adults. Some women or ladies under 18 who want to use birth control methods, the Depo could be discussed, but it's important to say there is a chance that you might experience bone loss, and it's significant because your body at this age of 17 or 16 has not reached its full bone mass. So you don't want to start taking a drug that can deplete it. Okay, that's the concern about women or girls or ladies under the age of 18. Okay, so that's as it concerns your bone health. Again, people who are at risk of bone thinning conditions, so osteopenia is the name. So people who are at risk of bone loss conditions, people who smoke, people who are on long-term steroid tablets or steroid medications, people who have suffered with anorexia. So there are certain conditions where you might already have low vitamin D, you might already be at risk of having trouble with your bones. So it's really important that we're factoring that into whether it's safe or not for you to continue using the Depo shot. So that's a risk in terms of long-term use. I've got a couple more, 2-3 more points. The next one is injection site reaction. Now, to you, this might mean, remember we said that you can inject yourself, that's self-administered, usually the subcutaneous type, the injection type that goes into the skin, different from the intramuscular, which is the one that's usually given by your nurse or your doctor. Now, in either scenario, you can have injection site reaction. So this is simply where you might develop some kind of inflammation or bruising to the area where the injection is given. And that's commonly, of course, as you know, in the buttock, but it can be given in the shoulder or different parts of the body. It's not unusual to have an injection site reaction, particularly if you're using it for long term. So the only way out of this is to make sure that you're alternating the location of these injections. It's tricky. Go and see somebody who's diabetic and on insulin, and they can tell you stories about injection site reactions. But they tend to have very small needles. They're familiar with giving the injection into different parts of the skin, of the tissue, so that inflammation is avoided. But this is a complication that could happen in somebody who's using the Depo for a long period of time. And one of the best ways to mitigate this is to have to use alternating locations. So if you use the right hip or buttock 3 months or 3 months and a half ago, then next time the left, and vary the locations. That's the best way to try and make sure it's being distributed and you're not ending up with scars and hyperpigmented skin because of the injection. Okay, let us quickly go on. Well, weight gain. Remember, weight gain is always a big thing, weight gain. But I would say I would also put it on my list of things to watch out for as a long-term complication. According to the studies, let us talk studies, there is no clear link, but there are ladies who say their experience with the Depo is weight gain. What the studies suggest is that this seems to be happening more in people under the age of 16, but also they were already overweight. They already had a BMI of 30 or more when they started the Depo. So it seems to be that the weight gain seems to be more in this group of ladies. And then the other thing that was observed is that if if you gain weight, 5% weight, within the first 6 months of using the Depo shot, then you're more likely to continue to gain weight on that method, which I think is a useful guide to you and to me to say, right, if I start my weight, if I've got a starting weight of 50 or 70, and by the time I'm taking the Depo shot, my weight increases by 5%. I can't remember, I don't know what that is off the top of my head, but my weight increases by 5%. In 6 months, that's a clue that if I remain on that method, my weight might continue to go up, and it's a call to say you probably should look for another method. I think that's a useful tip for ladies. But if you're thinking about Depo long term, have a think about this and see what happens with your weight, especially if you've not used the method and you're thinking about it. Just give that some thought. Okay, and just a couple more, and this is about cancer. Okay, and again, if you're going to stay on Depo long term, I'm looking at ladies maybe in their late 30s, early 40s. You want to stay on Depo for 10, 12, 15 years. Let's be conscious that there is an increased risk of cancer as people age. So that might be breast cancer, for example, which is talked about, liver cancer, which the Depo doesn't go well with. The Depo shot doesn't go well with. So somebody who's developed breast cancer. And again, this is why we say it's so important to make sure you keep these regular checks with your provider, or if any new symptoms develop, come and talk to us about it, because we need to stop, for example, somebody who develops a breast lump that is diagnosed as cancer, we need to stop the Depo shot because of the effect of the hormones on the cancer. So somebody who's been diagnosed or who has recently had breast cancer, for example, or somebody who has some kind of liver disease, including liver cancer, because this progesterone hormone is metabolized by the liver. So that affects, if the liver is not doing its job properly, that affects how much of the hormone that your body is exposed to. That's why it's relevant. So these are just a few things. I don't want our stream to go on for too long. I think we're coming up to 45-minute mark, which I think is a great place to round up. But these are some of the things I wanted us to cover in this particular stream. And you guys know I love talking about how different birth control methods affect us, particularly the challenges that we can have with them. So please go and have a look at my Smart Birth Control playlist. I do a lot of talking about emergency birth control methods. We talk about the Depo, we talk about the combined pill, we talk about the patch, and so on. So have a look if you're sort of trying to work out which seems better for you, or if you're having issues with one in particular, what to do. You'll find a treasure load of information on those in those videos. Thank you so much for joining me. If you've been on the stream, thank you so much for coming. I hope you found this useful. And if you're watching on the replay, I appreciate your comments, any thoughts, any contributions to the topic, your experience as well. Honestly, as I've said, it's difficult to be able to give you tailored information on YouTube. It's not designed for that, but we do have an email health information service. The link, it will be in the description for this video. If you want to post a question there, and then we can sort of look into the matter, get a bit more information about your background and give you some guidance about that. So guys, I'm going to round up here. Thank you so much for joining me. Don't forget to like the video. Please subscribe to the channel. Thank you so much to all the subscribers, new subscribers and old subscribers. Thank you so much again. You guys make it worthwhile. So I hope you have a great weekend. And please join me again next week, Friday. We usually do this between 11 and 12. I think we started about, just a bit before 12 this afternoon. So please join me. I think we're going to have, actually, I don't know what we're going to be talking about, to be fair. We're going to have a look at what questions come in. I think there was something about headache and hormones. So maybe that's what we're going to look at next time. But please send in your questions. It might be yours that I deal with next time. Have a great weekend and enjoy time with your family. If you're working like me, don't let it get you down. The weather is great out here in the UK at the moment. It's quite steamy. I've been thinking about taking the stream, actually taking it out into the garden. If I could get my computer with my StreamYard and take it out there so I can use it to share screens, I would happily do that because it's so hot in here. But maybe one of my videos that I'm going to edit, I might actually just take the phone and sit out there in the garden and do one of the videos this summer. I'm just giving that a thought. But it's been great to be with you today. So I hope you guys stay well, and I will see you next week. Bye-bye.